Hello, and welcome to Tandy Therapy Box podcast. I am Lauren Tandy, your host and clinician coach. I am an SLP, speech language pathologist, and multi-therapy private practice owner who promotes and practices hybrid services. I love helping other therapists thrive in areas of early intervention, caregiver coaching, feeding and swallowing or dysphagia practices, telepractice, and hybrid interventions. This podcast is meant for therapists who want to maximize their time and income without spinning their wheels. I invite you to join me on this journey and get involved in our online community for support and development of your individual skills. Welcome, everyone, and I am here to introduce my special guest this morning, Hallie Bulkin from Feed the Peds. Hallie is a business coach, clinical mentor, feeding specialist, certified orofacial myologist, and speech language pathologist. Hallie has a passion for sharing knowledge with colleagues in the pediatric feeding and orofacial myofunctional therapy spaces. You can find Hallie online on Facebook, Instagram, Feed the Peds, and also via her private practice. We're going to find out more about all of that today with Hallie Bulkin. Welcome, Hallie, to the show. I'm so excited to have you here with us. We had some things that we discussed that we'd like to talk about today. But let's start with, you gave me a little tips before we started our recording about podcasting. But what tips would you have for me or other new podcasters out there? Since this is, I think, my third podcast, I'm just getting started.
Awesome. Well, I'm excited for you. Podcasting was, if you had asked me like 3 years ago, I would have been like, me, podcast? What? No, like, why? Why would I do that? And it happened just because I went to look for a podcast and it didn't exist. And so one of my first tips that I always give others is, if you have something that you feel like you want to share, podcasts are such an easily consumable way for people, like while they're driving in the car, while they're just, out on a walk, while they're washing the dishes, they can put AirPods in their ears. It's such an easy way for people to consume helpful information. And so I tell everybody, let it be easy. Like, don't overthink it. Get your message out there. There's no such thing as perfection. One of my mentors always says, 100% perfection is failure, 70% perfection is success. And so that coming from type A personality, where before I had kids, everything I tried, I was a perfectionist, right? I joke, I'm a recovering perfectionist because I always thought everything has to be perfect and above and beyond, and it was exhausting. And so children basically taught me probably one of my biggest life lessons. There just isn't time for perfection. Let's just get it done. Exactly. And so that's what I applied to podcasting too, because look, you're going to laugh. My husband was just recently, I think, looking at one of my recordings, and he's like, we've got to fix your lighting for your podcasts and your recordings. It looks awful. And I was like, well, hey, I have 150 or so podcast episodes out there over the past almost 2.5 years now, and nobody's ever complained. I don't think anybody really cares, It was better before we moved, and just the lighting that I'm in right now is not the best. I'm moving again soon, and I'm like, it's imperfect, but I'm still getting all the consumable content people want out there. So let it be easy. Don't focus on perfection. And then I always tell people to, people are going to judge you one way or the other, good, bad. So just expect it. They're going to judge you if you put yourself out there. Put yourself out there anyways, because you're going to help more people, significantly more people than the number of people who will judge you. And most of them are probably going to judge you positively. And I think we all fear being judged negatively. So I say, just, let that go. And, those are probably some of my biggest tips about just from a mindset and, identity and that type of a purpose. And then my tips as far as from the actual the things that I use to podcast, figure out what platforms you already use and what might work well for you. I, for example, I try to be a minimalist. So I'm like, I was already using Zoom. So I just use Zoom to record. And then I have a virtual assistant who helps to piece everything together, and he puts it on Acast, and that sends it out to all the big podcasting platforms. Like, I've in the past, I've used a Yeti microphone, and now I use a Rode Pod mic. And I have like a ring light and a Lume Cube light. And, it's not perfect, but it works. And again, it gets the content out there. So for me, like there's a whole bunch of other things I use too at this point, just to gather information from my guest speakers. I use Typeform, and it lets people kind of fill in everything so it can help guide our episodes. And aside from that, I try to take that like let it be easy approach, like very laid back, conversational. And I've had so many guests tell me like, oh, this was so easy. Like, I don't know why I was so nervous. Like, it was very conversational, like having coffee with a friend. And I'm like, yes, because to me, that's the best way to go about it. I think people would be bored if we were like, boom, 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 let's answer these 25 questions. No, like, let's just see where the episode takes us and have some talking points to guide us along the way. So I know that was a lot, but those are like my biggest tips.
Well, I had several follow-up questions in my head. Let's see if we can get to some of them, because I forgot a few. But thank you so much for those tips and that information. That's great for me. And actually, your lighting, as I was researching podcasts and different ways to do it and different intros and things like that, your lighting was inspiring to me to just get started, because I'm like, I don't have all of my pieces in place. I don't know, like that tip about, what did you call it? Acast. That was something that I was still researching. So thank you.
There's so many out there now too. If you just like research best podcasting platforms, you'll find like there's like Libsyn and Podbean, and I don't know, there's like so many of them. And honestly, if they're out there and they have a decent reputation, like I don't really think it matters. I started on a different one. It was bought by Acast, and I just stuck with it because it works.
And so I know that you are someone who has been open in the past to giving me recommendations and some kind of mentorship in previously creating classes in the caregiver coaching realm. But so tell me a little bit about your podcast and what you talk about in the content that you're getting out there.
Yeah. So my podcast, when I went to go search for one, I was looking for like a myofunctional therapy, lip tongue tie, tethered oral tissue, airway focused podcast. And it didn't exist at the time. I think there were like a couple people who had been guest speakers on other podcasts that popped up, but we like researched extensively and nobody had a podcast on these topics. And I was like, what? We got to change that. And so I always joke, like, in true Hallie fashion, like, I was like, all right, I guess it's going to be me. So I just hopped on there and initially shared our story, and then started inviting guest speakers. And we've had some really awesome people join us. And it's evolved over time to also include pediatric feeding, because, with Feed the Peds in my course and everything, it's just naturally like, how could I not talk about that and in the work that we do and my own children and everything. So now it's really more of like a myo, tots, airway, and ped feeding podcast. And we have, specialists as well as patients, as well as parents of patients on there to share stories, share our latest research, talk about, just different topics that I think that the general public needs to be educated on, because there's this movement to all like take our own health back into our own hands. And so making this information accessible was really like goal number one for me.
Right. And I love that, because I don't know if you know, I love pediatric feeding and dysphagia, and that is one of my specialty areas. I am not certified in COM or oromyofunctional therapy yet, but I did start down that road and kind of asked you for some mentorship in that area. And I love that you're putting that information out there, because one of the reasons I got into that area was because as a mom, I couldn't even find, asking the doctors and the nurses, I couldn't find the information that I needed for my kids and the practices that I wanted to be the best mom that I could. But they don't tell you whether or not to use a pacifier, how long to use a pacifier, if it affects bottle feeding or breastfeeding, or how the bottle affects breastfeeding. And so that's what I did my thesis on. And that started a journey for me as well in pediatric feeding. So I can empathize with you there.
That's
All
awesome.
right. So let's get on. I'm doing a little project and I'd like to start documenting some of our profession's growth and changes through the process of dealing with COVID. So I know my practice has changed quite a bit, and I would like to find out what that looks like for other clinicians and you and our practice as a whole. So today we'll find out how your practice has changed from pre-COVID in the beginning of 2020 to now. So why don't you tell us a little bit about what it looked like back January 2020?
So this is a really interesting topic for me for several reasons. One, we were doing myofunctional therapy for some patients virtually before the pandemic hit, just by nature of living in the DC metro area. And, myo sessions can sometimes be like 30 minutes instead of our normal 50 minutes. And so I got to a point where like I was the first one who was certified and doing myo in my practice. It was really just me. And then I quickly brought on some other myotherapists to help with the caseload. But I only had, a lot of these kids were older ages and after school hours. And I only had 2 days a week I was working after school hours because I've got little kids at home and that's all I wanted to work. So I was trying to like cram, like I was like, okay, well, I can see 4 kids a week for myo after school hours, or I could potentially see like 8 to 10 if they come to me in those same amount of hours I was already working.
Right.
So I ended up having them come to my home office. I was still traveling during the day to some of the private preschools I was going into and some private homes. And that was pre-COVID. And then in the afternoon, I had a combination of kids coming to me. And then I started offering virtual services because with traffic, it's like to get the kid from school. They would try to drive from DC to Maryland. It was awful. And as a mom, I was like, I hate driving places for appointments.
Right.
I really hate it. So I would have them come in for an in-person evaluation at the very least. And then sometimes would come like between, certain phases of the program just to do check-in in person. But otherwise everything was, virtual. And I was like, oh, I really like this. And so I had part of my team who was doing myo was also doing the same model. So thankfully for me, when the pandemic hit and everything shut down, thankfully, not thankfully, I lost 50% of my practice overnight because families were like, yeah, no, we're just going to wait and see what happens. And then the other, part of them were like, yeah, we're not doing virtual therapy. Like we're already trying to navigate virtual schooling. It was just, and it's private pay and it's not cheap. And so I think, and parents were losing jobs. So, in the DC metro area specifically, and I haven't compared, job loss and, to other areas of the country. I don't, so I can't really speak to that. But I think the area was hit really hard financially for a lot of families. And so as a private pay service, we were one of the first things to go from their expenses, regardless of how badly the child needed therapy, right? And the clinics that took insurance, a lot of them shut down too for a couple of weeks. And it's not like they were all running over to these other clinics or anything. So we're kind of like, let's ride this out and see what happens. We did have some families who were willing to try therapy. The other 50% were like, we're here regardless of, our child needs it and we'll make it work. Or they just had the means to be able to afford it. And they were open to virtual. So, overnight we saw things drastically shift. Now, at this same point, March 16th, 2020, I launched my first online course, which was planned since August 2019. So I was like, yeah, we're not going to like delay this because I don't know what the future looks like in the world right now. Everyone thought we'd be back at work in 2 weeks, right? We're like, just a couple weeks, like 2 years later. So I'm really glad that I launched that because one, I was able to not just train my team that had never done therapy online before, how to do online therapy and be a support system for them. But I was also able to connect with a really large group of professionals who had been following me since I launched the podcast in June, July 2019, and who had been on the wait list for my course. I did a free training that week, and all these individuals who were kind of like, well, I don't have anywhere else to be, all got on Zoom. Like we had dance parties with my kids. Like I was like, I know this isn't part of this launch and it's completely like unrelated to ped feeding, but I know how to do this, and I feel like I'm just gonna hop on and answer questions and do a free training on like how to do teletherapy, like just get
Right.
out there and started. And so I started giving some tips on that. And so it was a really pivotal point, I think, in my career because, you know, as a coach and a mentor who's already was doing like business coaching and also doing some mentoring clinically,
Mhm.
and treating and being a mom and now running this online business, you know, we had no idea what was coming our way. But you know, since that point, we've launched it 7 times. We're in the middle of our 7th course now. We launch it 3 times per year. It was always planned to be an online course, never planned to be in person. And to this day, like no plan to change that yet. So I'm very grateful that I had that income coming in because the private practice income, like I said, it literally just dropped 50% overnight. And we also, it took us about a year to build back up to where we were and start going beyond that. And, you know, I don't do like hardcore marketing for my private practice. It's all word of mouth. And I didn't change anything about that. I was like, you know, when people are ready, they will come back to us or go somewhere else. And others still, you know, we still have our reputation in the area. So as people are ready for therapy, we will start to do more and more therapy. But it was very interesting because the response from different patients, like some patients were like, yeah, no, like, you know, and we don't have to get into the whole like vaccine and mask talk, but some were very pro, some were kind of against, you know, some were like, hey, can we not wear masks because this is feeding therapy or speech therapy? And you know, if my therapists were okay with that, we did it on like a case by case basis as to, you know, maintaining certain PPE, making sure we were, you know, following any local guidelines, of course. Whereas others, you know, masks have been lifted and they're like, can we continue therapy outside with masks on, right? So it's been a very interesting thing to navigate as a private practice owner who has a responsibility to, one, follow local guidelines, but also do what's right by each individual family and the therapist who is working with them. And so it's
Oh,
definitely not for the
I
faint
know
of
all
heart.
about that too. And I know also that providing dysphagia intervention or oral myofunctional therapy via
Yeah.
telepractice is sometimes, especially in the current atmosphere with the regulations, easier, better, more natural environment for the kiddo, depending on the age and the need. It really lends itself to a lot of benefits in that treating realm. And so, tell us a little bit more. So, you talked about your private practice and then feed the peds. So, those are two separate things, right? So, your courses and then your private practice. Where is that located?
So the private practice is we travel to our patients. We don't have a physical location. So we travel across DC, Maryland, Virginia, and then we do virtual throughout like New Jersey, New York, and Florida. So it's kind of followed me as I've moved. And one of my therapists also moved from the New Jersey, New York area down to Florida and is licensed in those places. So it's been kind of cool to be able to expand our reach a little bit.
Great. Yeah. And so what all does that include and how many therapists do you have that are providing what kind of therapy?
So I have about 25 therapists, and some of them are very part-time and just have a handful of clients, and others are pretty much full-time. They do a mix of therapy. So some of them prefer in person and don't really want to do virtual at this point, whereas others are like, I like the hybrid. It's more challenging. It's more, you know, it just kind of keeps me going, different modalities. And I'm kind of like that too, where I really liked that hybrid approach. But we cover a variety of things, right? So we have therapists of all walks of life. We've got, you know, traditional speech language therapy. We've got, someone who specializes, she's a certified autism specialist. We've got, you know, OTs on the team as well who do some fine motor and sensory work and vestibular work. You know, I would say we've really got the full gamut of SLP OT from a pediatric standpoint covered. And what we try to do is, you know, we also obviously have the myo side, the feeding side. and we do myo with adults as well. I should add that in. Habit elimination, all that fun stuff. But we really try to match, and this is what gets a little tricky because we also travel to the patients, or, it's a little bit easier if you're doing virtual than traveling. But from a scheduling standpoint and specialty standpoint, we match the therapist with the needs of the child. And you don't always know that on day one, but we really try through a very comprehensive intake to get a good read on, like, what is this child struggling with? What does the family, why is the family coming to us? What do they want to work on? And matching that with the right person who is going to be a good fit for them. It's one of my biggest pet peeves is, and I'll call out other practices, is just kind of like filling a schedule, and I've received therapists from other practices who have said, yeah, I joined that practice because I was told I would be mentored and trained more in feeding and myo. And then I got there and I got an entire caseload of 13 to 15-year-olds with language issues. And I'm not even trained in that. Like, I haven't done that in 15 years since I was in grad school. And so for me, it's really important, both from a patient standpoint and from the therapist standpoint, that it's a good fit and that they're really using the skills and building the skills that they want to together. So that's, it's a little bit about the practice.
So it sounds like it's been a hybrid the whole time because of what your practice lends itself to in your kind of business model. So how has that part of your practice changed 2020 to now, if at all, or has it stayed the same because of how you set it up previously?
So the actual practice itself stayed relatively the same. It just fell on me to put a lot more like rules, regulations, and things in place, like communication wise with what we were doing.
That's the hardest part, isn't it? When you're working remotely, because my practice works very similarly, and we're now in a clinic space, like a brick and mortar building or two buildings, and it transitioning from having all that levity and all of that freedom and traveling and telepractice, and then going to the expectations of being in a clinic and what things used to look like, it's just different. And it's different expectations, different practice models.
Yeah.
I get you.
Yeah. And I would say we're definitely doing more virtual now than we did in the past. In the past, it was more so like, oh, okay, well, traffic is a pain, so let's offer you the virtual option. Whereas now, I've got therapists with entire like 100% virtual caseloads, and that was never the case before. So it's definitely changed in that modality. And I will tell you, like, maybe 3 of us were doing virtual before the pandemic, and I probably had 20 therapists in March 2020. And so most of my team had no clue, and they were like, how do we do this? And a lot of them not myotherapists, or we're not feeding therapists, and we're working on other skills. And I was like, I don't really know I don't know how to use a boom card. Like, I don't even know what a boom card is, but I will support you in learning that. Like, you tell me what you need, we will get it all going. And it was actually really encouraging because one of my therapists was able to come in and teach others, like, hey, this is how you use boom cards. And hey, I'm making some of my own. And hey, there's this, and you can find resources here. And so the beauty of it was, like, because we were a practice that doesn't have a brick and mortar and we don't really get to see each other or communicate with each other like that frequently, everybody really came together and supported each other at that time. And, I think that was really nice. And one thing that you mentioned before about, the fact that virtual therapy actually can be more successful than in-person therapy sometimes.
Absolutely.
I really wanted to speak to that real fast because we work with a lot of families with feeding issues, and there's high anxiety and a lot of emotions surrounding children struggling to feed. Not every family, but a lot of our families. And I think that, having the virtual option for some families actually decreases that anxiety load. And then the child, right? So the child is going to feed off of the emotions in the room. And so if the parent is a little bit less anxious and the child is then less anxious, they're more available for the therapy that we're doing. And at the end of the day, I think it also forced us to be a bit more creative in our parent, what we were teaching the parents to carry over, because we weren't there to put our hand on the child's face during therapy. And so some people will argue, well, that's a downfall and that's not good. You have to be there. I'm like, is it easier for us as therapists? Yes, to be able to put our hand in the face. But one, children don't always let us do that in the beginning of therapy. And two, we can still be highly effective in feeding therapy and myofunctional therapy assessments and treatment without ever putting our hands on a face. And I know I get a ton of hate for even saying that, but how do I know? Well, we've done it, and we've seen kids make drastic improvements. They are functional eaters. They are healthy. They, everything has fallen into place for them, and we've been able to close that gap, and they're now going to school, eating their lunch, participating with their peers, not vomiting in the cafeteria because of the sensory stimuli, sensitive reactions, responses.
Right.
So there's so much that can be done so successfully. And I really love that you said that, because I think people just see it as an alternative method when it should be considered a primary method of therapy to make it accessible, but also because for some kids, it is a more successful modality.
Right. And I will second that 100%. There's nothing that bothers me more than someone who doesn't do feeding and swallowing interventions saying that it can't work via telepractice or questioning your recommendations via telepractice. So I can hear you right now. I can see you very well. The connection is great. And if you have hands-on the other side, which, is required in telepractice to have the parent there or a helper with a young child, you can accomplish a lot, and you can see a lot, you can hear. I mean, if they cough, I'm going to see and hear it. So
right.
For someone to ask me, well, how do you know they coughed? Well, I saw and heard them cough. So it's just funny to me how people question that. But I feel like through this process, and that's part of what I want to examine here and document, is the changes in our practice and the shift from questioning that to have the experience under our belts and even research as we go, or case studies. You do case studies. I do case studies. Maybe one day this will be the primary, one of the primary forms of intervention for dysphagia, and I look forward to that, and oral myofunctional therapy. I do know, are they still requiring the evaluation for oral myofunctional therapy to be done in person, or?
That was never actually like an official requirement.
Okay.
So yeah, and in like registered dental hygienist.
That was just for the certification, wasn't it?
Yeah, maybe. I don't even remember.
So you got certified before
they changed things.
Yes,
yeah.
they changed it. So they were kind of like figuring out what to do, what to allow telepractice, because they used to fly to your site to watch your clients that were set up for what they require. And then I think they did it virtually for a while and allowed you to do virtual therapy, but then the evaluation had to be done in person, I think.
Okay. So like your dental hygienists, a lot of them, so they're not limited like we are as SLPs to only practice in the states where we're licensed. They are able to practice anywhere globally. And so a lot of them do. I'm like, come on, Asha, like, can we catch?
No, that's another I'd like to lobby
and everything they're working on, but it's not like officially out there yet. And I'm like, can we move this along a little faster?
Yeah.
But a lot of them had been doing virtual assessments and treatments globally before the pandemic. So for them, I think it was a lot easier than for us SLPs, because that's just not what so many of us were used to. But it's been done for a long time that way. And that's the thing that boggles my mind too. Like, it's not a new therapy modality. I think just the volume of how much shifted at one time unexpectedly, and how many people weren't trained and really how to do it, been kind of, it's tricky. Like, we had funny stories in the beginning where someone was like, so the 5-year-old just took the parent's phone and put me in the underwear drawer and walked out, and the like, come find me. And mom said, like, I'm so sorry, he put you in the underwear drawer and closed the door and walked away. So it's like, there were little things that we had to like figure out, like, how do we get these kids to not end the Zoom call? And how do we, it was tricky too, because I think everybody was stressed and overwhelmed. Parents were trying to navigate this. and sometimes they had to be on work meetings when we had a session. And so maybe the parent wasn't always sitting there when we would expect them to be. And so, it just became another task in the beginning of the pandemic, which is why I think, especially in a lot of the dual working families that we see in like the DC, Maryland, Virginia area, I think that's why we had such a like drop in therapy
Right.
overnight, because it was like, nope, just can't handle one more
You're
thing.
right.
And I
Mhm.
totally get it. Right. So, but I think it's evolved since then, where like families now understand that, we need to be present, or we need somebody present with the child in most cases. If they're older, like that's a different story. Like our 8, 9-year-olds and everything are usually okay by themselves. But my daughter's 6, and you'll laugh at this. So Jess, who is one of the therapists who moved from New York, New Jersey down to Florida, she actually is treating my daughter for myo right now, and she's on my team. And we are literally like 10 minutes away from each other in Boca and could do this in person, but she treats her on Zoom on Friday afternoons after school. So like, that's how much
So
I
much easier. It's so much easier.
it is
I
so much easier. Like, she's like,
yeah.
I could come over. And I'm like, but why? Like, all of your other people are virtual for the most part. Like, just whatever, Zoom, it's fine. Like, so I mean, I walk the talk, right? Like, my own child, I am paying for my own child to see one of our therapists over Zoom for myotherapy, and it's working beautifully. So
Right.
there
So
you have it.
we have well, I have 3 kids who have their own individual needs, and I empathize with you, using your child as a case study for your putting information out there. Um, One of my sons in particular has EOE,
Mm,
eosinophilic esophagitis, as well as a few more diagnoses on top of that now. And so a lot of anxiety. And when you talked about reducing that anxiety, I mean, we found out when he was 2. And so he started with a fresh elimination diet. He didn't know what he was getting at that point because it was just the beginning of food, right?
yeah.
So it was the very, very basics. And so that anxiety about food started at a very young age. When we started doing therapy for that, there's no way I could get him to go to a therapist's office. No way. And even with our virtual appointments, it took about 15 minutes for him to come out from hiding under the table to join the session. And it usually was a fun game that she was enticing him with before we got to the meat of the session. But I knew all about that, and I knew how it could help taking that anxiety, like you talked about, away from having to go to a doctor's office or a clinic or wherever, the counselor's office. And it is the only way that I could get him treatment to help with that anxiety. So I personally, as a parent, I understand that too. Sometimes it just is easier because if we have multiple young children, are working moms, and have to take care of a household, have a business even. We have so many appointments and things to do in the day, and to take driving even 15 minutes there and back off of our plate, that's 30 minutes where we can like do 2 loads of laundry, or full laundry, or prepare dinner, or whatever
Yeah.
we need to do. Jump on and answer emails for work. So I loved it, and I still love it.
Yeah. Well, and I think the other thing you mentioned too is it took them time to warm up, but some of these kids don't ever warm up in person, or they never really truly let their guard down because, like you said, they already associate a clinic or a doctor or medical office with, somewhere they don't want to be. And so there's that anxiety. And then on top of it, like, let's say we're working on introducing new foods and they walk into the room and there's foods out, or even if it's closed in a glass container and they see it visually, right? There's just
Mhm.
so many different triggers that I think can set things off that are not an issue on a Zoom session, or on, not always Zoom, but on virtual therapy. And so I really think that it actually helps to control the environment a little bit better, which for some of our like highly, not reactive, but like,
Sure.
highly impacted children,
Yeah.
where it's going to take them some time to warm up and let their guard down and fully trust you and build that rapport. Like, yeah, it could take just as long, if not longer, in person. And I think people constantly would say like, oh, the kid can run away from the table. What? Because they're not doing that in the therapy room? Like, what, are you
Mhm.
strapped down? I mean, we don't subscribe to that whole methodology.
And
So
even if they're not running away, if you're trained to recognize cues, you can see them shut down. So they're
yes.
looking away. They're doing all that they can to control their bodies. And it could be traumatic for them. And so in their homes, they're in their natural environment where you know that they can function at some level, right? And that's where you start. So I love it. For oromyofunctional therapy, what is required? What are the tools that you need to provide services via virtual telepractice?
I love this question. So
Yeah.
when I started, I was like, we got our Myo kits and everybody gets the same kit. And like, I feel like this is a waste of materials because not everybody always uses everything in an eval. So I went from putting like 7 things in a clear Myo bag with my card on it and everything, right, to having like the 3 minimal things that I know everybody uses, like a coffee straw, because I would use that as like a target for the tongue.
Mhm.
I would have the quick tongue tie assessment tool, that little paper piece, because that we take measurements with. And even if we don't get a suction, we're still measuring other things.
Right.
And then usually a tongue depressor, which not everybody needed, but sometimes I would just give it to a young, like a 4 or 5-year-old as like a toy. And I had flavored ones, colorful ones, wood, plastic, different parents, plain ones, different parents have different preferences. So those were like my at minimum, those 3. When we moved more to virtual, the only thing that I send to a patient is the QTT. We send one quick tongue tie assessment tool, that little paper tool to measure, and we teach them how to do the measurements on themselves, like during the eval with us.
So you
So
walk them through it and
yeah, yeah, exactly. So it's really it made us become a minimalist. And if there's certain, and then also in approaching Myo, it's so individualized that we never really know what someone's going to need, if they're going to need a bite block or they're going to need, and we can advise them on where to buy certain tools as needed, if needed. We've become really, good at like saying, hey, we want to see your bite. Do you have photos from your dentist that they can forward us from, like, those images
right.
that they've taken in the past? Or if they don't have that, we have them get like large kitchen spoons and like hold their cheeks back like actors, and we get a good, is it perfect? No, but like nobody's grading us on like how perfect our images were. It's more for us to get information so that we can determine functionally what we need to address. And
Yes.
yes, do we use our evals, and we promote the whole idea of using our evals as a marketing tool and sending them to other providers? Sure. But you can also choose which images to put in a report and which images you don't put in a report. And guess what? Some people send reports with no images. So, it's one of those things where I think people, again, get so like caught up on the perfectionism and like, I
Stuck
need
on
all these things.
perfection.
How do you do this? This is how we do it.
Oh, my therapist gets stuck on perfection sometimes when writing the report, and you'll see, that 7-page report. And I used to do it as well. And so as you get further along in your career, simplicity,
Yeah.
minimalism, getting to the point becomes more and more important. And you kind of get better at screening out all of the extra noise. And really, all an evaluation is supposed to do is qualify or not qualify, right? You're going to be doing your therapy later on as you go, sometimes in the first session. But I tell my therapist, you don't need all the information in that first meeting. You
Yeah.
need the information to determine, do they qualify, do they not qualify, and what do they need to
Yeah.
guide your therapy. So I I actually am of the very same thought process and that's actually what I teach in my caregiver coaching masterclass is the simplicity, not bringing a bunch of tools to an evaluation or therapy, not spending a ton of extra time laminating things for your session, using things that are around the child in their natural environment in the home. So I completely agree with that approach. Anything else in the oral
Um,
myofunctional world, though?
So I ended up creating a course because a lot of my members in the Myo membership were like, can you put this into a course for us and give us more of this, that, and the other? And I was like, okay, yeah, I've been talking about doing this for a couple of years. So I finally did that and launched it at the end of last year. And then of course came like the request to create another certification option. And so we did that.
So
and the reason
what is that course called? Which one is that?
that's the Myo method. So the Myo method. Yeah. So the certified myofunctional therapist CMT like credential that we're creating is a true like certification. It's different than just completing the course. It's separate. And one of the things that I thought would be really cool is, during my course, I actually do 5 evaluations. 2 are in person, 1 adult, 1 pediatric. The other 3 are all virtual, 1 pediatric and then a teen and an adult, because I wanted people to see that you can do this in person or virtually and still gain most of the same information. And then I love how you said also, like, you don't have to get everything during the eval appointment. Sometimes we just don't, and that's okay. And we can get that information if needed as we continue, because therapy is dynamic and it changes.
Right.
And so we might go in saying like, hey, you know what? I know what the diagnoses are. I know what my initial, treatment goals are. I know where we want to be at the end of treatment. How we get there and what we work on along the way is completely independent and based on that patient. And so I don't love these like 12-week Myo programs and everyone gets the same, exercises. And no, that's not therapy. We get those kids and they are not anywhere near graduated, unfortunately, because it's not individualized. And they truly, just like any therapy that we do as SLPs, that therapy needs to be individualized to the patient. So one of the other things that I did in the certification was I'm giving them as part 2, step 2 is to watch 2 evaluations and to create like a treatment plan and there's some questions associated with it as well. And I won't give it all away, but so there's 1 pediatric, 1 adult. They're both virtual evals that I did specifically for the course. And one of them is a pediatric case where she doesn't do like half of the stuff that we need. And I have to basically say, hey, mom, like, can you send me some videos of some of these things afterwards? And so, my idea and like the way that I do everything, whether it's Feed the Peds or the Myo method or the certification, is I want therapists to think critically. I don't want to hand you everything. I want you to start thinking like, like what happens in this situation? Like, what should I do so that when you leave, you have a better grasp on like, okay, I can pretty much eval anybody, but like after that, what do I do next? Well, you'll have an idea of where to begin and then where to go. If you start to think and if you're taught in a certain way and you're not handed all the answers on a silver platter, and we challenge your thinking and we teach in different modalities for different learners. And so that's a big part of like why I do what I do. But I also employ the parent as a very big component of those virtual evals because they're really key, very instrumental in, giving us information based on what we guide them through. So I love that you have like a course that kind of helps with that.
It's clinician coaching, parent coaching, caregiver coaching, whatever you want to call it. I find that it is the most effective way to exactly what you said, connect the dots in the clinician's brain or the parent's brain to where if something similar but different comes up later, they have that course of thinking to problem solve themselves rather than to come to the therapist every time and say, what do I do now? What's next? How do I target this? And really, that's how you grow as a professional or a parent in feeling confident in your own skills and wherewithal. I mean, you might not have the skills to begin with, but if you have the ability to critically think through what to do, you have the skills that can grow. So yeah. I like that.
Yeah. And I always say, like, we're lifelong learners. Nobody knows everything, not even the experts in the field. And if anybody tells you they do, run, like, because that's just, it'll never happen. We'll never know everything. And so I think that a big part of that is like accepting the fact that, we all need to know where to start. And then we all need to be open to our continued education and in this space and this specialty, because that furthers our critical thinking skills. But, it's just like, we have to move away from, okay, what exercise do I do for this? And which one do I do first, second, and third? And that's not something that we can tell you for every individual. There's not one program that's going to apply to every single patient. And that's why it's so important to develop those critical thinking skills. So like you said, when you are sitting in front of that patient and you're like, okay, this is not working, you can think a little bit creatively and try something else and see, okay, did that work? Can we modify this a little bit? And that's not something you're going to always learn in a course. Like, sure, you can communicate with colleagues. You may link up with a mentor. People will help give you some ideas and think a little bit more creatively or tell you what they've tried in that situation in the past. And that's absolutely valuable and helpful. But you're not going to necessarily consult on every single patient that comes your way. So at some point, it's like we kind of got to grab, the reins ourselves and trust ourselves enough to try things that we think might be a great idea without someone else telling us first. And so that's what I really hope to create, like in clinicians, that critical thinking and the freedom to trial what you think might be best for this patient.
Right. Yeah. And even on the caregiver side, coaching the caregiver through that so that they feel confident, having that therapy and graduating, but then still feeling empowered enough to address things as they come down the road. And figuring out when they need help or when they can handle it on their own. So I want to give you a chance to talk a little bit about the journey of your courses from when you released in, did you say March or February 2020, your first course?
March 2020.
Yeah. And so that's another aspect of what you do, but that's a big aspect of what you do. So from then until now, and it lends itself very well to us being telepractice and not in the room, hands-on all the time, and not doing in-person presentations or seminars, having it all recorded or joining live online. And that is what I'm doing, but I started it right the night that things closed. I didn't have it planned ahead of time. I started my early intervention telepractice group the night before schools closed because of COVID. So that was the start of my online presence and classes and resources. But you having planned ahead of time and then gone through all of it until now, here we are over 2 years later. What has that looked like for you in that realm?
So I want to back up for a second because I think that what I want people to also understand is the reason why I was doing it online was because I am that busy, like business owner, clinician, mom who I enjoy traveling, but I'm going to be honest, I really rather travel for like pleasure. And it's not like, forget the money side of things, right? Forget how expensive it can be to travel for a CEU course. It's not even about that. It was just like, I would go to these courses and be away from my family. And I feel like every time I was away, like one of the kids would get sick or, just something that I would feel like I was missing out on. And I was like, as their mother, like from an identity standpoint, it's really critically important for me to be there for my family. And so, if I'm going to go choose to attend a course once or twice a year away from home, that's fine. But I don't want to be like, for me, it felt like someone was like ball and chain. Like if I had to teach in person, like that would go against everything from an identity standpoint. I was like, no, this is not where I am in this season of my life. And so I know that like online courses, especially a 40.5 hour online course, like that was unheard of. Nobody was doing that in our industry. Like there aren't even 40.5 hour courses in the pediatric feeding space. And so it's funny because I was going to do the Mayo course first. And right after like we released the Mayo method, the Mayo membership. So the podcast was born in the middle of 2019. And then in August, I was like, okay, let's plan to do a Mayo course. And one of my good friends was like, yeah, so we need this like pediatric feeding course. So like, I think, that would be really helpful if you want to do that. And I was like, no, I definitely don't want to do that because that sounds like a lot of work. It's just really in a place in my life where I'm trying to minimize how much work I'm doing. And I'm laughing because an online business is like a job and a half. So, anywho, so I thought about it for like 24 hours and she was kind of like, well, I'm going to tell somebody else to do it if you're not going to do it. And something about this like lit up inside. And I was like, I actually feel like I need to do this. Like, I don't know why, and it's funny too, because I don't take direction from anybody else. Like, you tell me to do something, I will run so far in the opposite of direction of what I'm told to do by nature, that, the fact that this was like brought up, and then I was like, yeah, no, that seems like a lot of work. And 24 hours later, I was like, something about this is telling me I need to do this. Like, I don't know why. But if I do it, it's going to be with a team, because I have my specialty, and then I don't have experience working in a NICU or a hospital setting, or, in a brick and mortar private practice. I travel to homes, and, I don't have lactation credentials, but I think that's important if we're talking about this topic. And so what it did allow me to do is create like the first course that was comprehensive in ped feeding, that would teach you how to assess and treat. Started with like, what was the typical skills that we expect first, so we know when we're going off, the trajectory. In doing that, we created, and I had a team help me, I didn't do all this by myself. We created a pediatric feeding screening tool, which is what I do a training on before I launch each course. And I think that's helped open up the eyes of a lot of individuals, because they're like, oh, I can screen this.
To look at that.
Screening for this, number one, and number two, wow, it's really easy to see. I can do this in 3 minutes while they have a snack. Oh, okay. Why hasn't anybody taught me this? Yeah, me too. I wanted to know the same thing, right? And so then what I did was I was like, all right, I actually had 6 people initially lined up to teach this course. We were each doing like 2 modules each. And my 2 modules were 7 and 8, the TOTS and the MYO modules, as it applies to birth to 4, like birth to 5, the early years before traditional MYO. Like, how do we adapt it? Hopefully these kids don't need MYO. How do we intervene now and not tell people to wait because it's not traditional MYO age? Yeah. So I was like all fired up.
That, by the way, I went through that initial course for COM, and I do not get why they started traditional MYO at what, 5 or 6?
Yeah, it's like a cognitive level of
what about
like,
all this?
I get it to some extent, because it's like you really have to have the cognition of a 4-year-old to follow a traditional MYO program. But as therapists, if we think critically, like, why can't we take that and modify it for it's the same goals, right? It's just a matter of how you get from point A to point B, based on the age. And so that's why I always call it like feeding with a twist of TOTS and MYO, because it is a more sensory oral motor approach to addressing those MYO issues. We're doing more passive, exercises maybe on the child when they're little, and then it becomes a little bit more volitional as you move towards like 4 years of age. So I do.
Modifications versus exercises. There's so much you can do.
Yeah, and we have to do modifications in traditional MYO too, like for some patients. So it's not like forget that. But I think it comes back again to those critical thinking skills, understanding how to apply what you're learning conceptually, theoretically, in practice, and not just following the same set of exercises for every patient. And that's where I think a lot of people get stumped. But anywho, so I was really excited. And then with COVID happening, like literally, because we had not even created all the modules when we sold the course initially, like we were still in creation mode, and I had people back out like as COVID was happening. They were like, yeah, no, I can't do this. Like, okay. And so like the 7th hour, I had several people back out. We were down to like 3 of us. And then Ramya came in and joined us, who is now like one of our main, she's actually helped redo a lot of the course, like re-record things, because she runs a bulk of the modules at this point. And then there's Caitlin, who's our resident OT. And they both have lactation credentials as well. And then there's me, and I really, I sell the course and everything. And then I focus on the TOTS and MYO stuff, and I pop in, and everything throughout the other weeks, because we have live Q&A, or not, well, we do have live case studies, but we have like 24-hour Q&A on the Facebook wall to ask questions as you go through the recorded modules. But it's worked really well. And like, we've been able to finesse it so that it's really like, it's so exciting to see the types of questions change over the 12 weeks together, and to watch the thinking. You can like see the wheels turning in a different way. And we're birthing critical thinkers out of this course. And it's like so freaking exciting. So I know that's more than you asked for, but I think that what's happened is people will say, or like, can you do this in person? And I'm like, no, Not right now. It's not going to happen because
well, also from someone who's signing up for these courses too, I'm traveling in April for training that has been online for the last 2 years because of COVID, and we're finally doing it in person. But I'm doing it mostly for networking. However, it's expensive. It's expensive to go to a course, especially now with airline prices going up because of gas prices going up.
and inflation in general. Yeah.
Yeah, food, the cost of the course. So all of that together, I think makes it such, a no-brainer to do an online course. And
Yeah.
I've done several and offered several speaking courses since COVID hit, but I think it's a no-brainer. It makes sense.
Well, and like after we finished the first course, we also released the Myo membership because I was like, I got to get something going. And I feel like it would be really cool to have this monthly membership where we're doing case studies together, and we're coming together because the big thing I was hearing from a lot of people was they were taking these intro courses, they were leaving more confused than when they entered, and they were having a really hard time finding a study club. And that was before the pandemic. Now we're all sitting at home. Some people are doing virtual, meetings with their already established teams, but it was so much harder for people to try and connect because they didn't know how to go about it in this new world, right? And so I was like, all right, we're going to birth the Myo membership. There's nothing like this out there. We're going to give you some research reviews because people are like, there's no research. And we're like, there's plenty of research.
Yeah.
We will of it for you and put it in pretty PDFs so you can go share it with your patients and your, other professionals that you interact with. We bring in a guest speaker every month that does a 2-hour online training. And at that point I was also doing business tips each month too, which, there's a whole library of them now. I'm not doing those anymore, any new ones currently. But so we had the CEUs, the research reviews, and then the live study club, which was an hour a month. And so that's evolved over time. Sometimes we had patients present for that. Other times, it was just the person who was presenting would come on and kind of walk us through everything. And we always had them bring their questions. And then we would talk about it as a group, and we would ask questions about the case. And I think just seeing different cases, seeing different evaluations, seeing different, responses to questions, and how not everybody sees things through the same lens or answers things the same way has just really helped to evolve those who've been in the group. And, we have over 450 monthly members right now, which is exciting because there's a lot of SLPs, OTs, and RDHs mostly who didn't have communities where they either felt safe asking questions or they knew who to, they're still trying to connect with people in their communities and help their patients. So it's been really cool to see that evolve. So that's been going strong, but it's, I think it's the way of the future, quite honestly, because I think people want.
Amen, sister.
Yeah.
It is. It's, I feel the reason that I wanted to invite you is because I respect that you could see that through the whole process and continued on with your classes and your virtual offerings and community. And I think that is also the same reason that I created the early intervention telepractice group and Tandy therapy box, is because we needed that community. And I, for different reasons, for caregiver coaching and early intervention. But I also love the dysphagia world as well. And so I love that you're putting that out there. So I know that you are on a time frame with kiddos and such. Is there anything that you want to add that we haven't talked about today?
Goodness, we've talked about so much.
I know, and time has slipped away.
I'll say this. So one of the things we didn't talk about is that, online and in the world of online, social media and everything, right? Everybody is now putting out all this information. And I think it's actually become very overwhelming, right? We didn't have this much going out several years ago. And not everybody's very kind either, right? We have professional groups where people are not kind to each other. It's quite toxic. So that's one of the things that, in my programs, I created something called the elevation movement about halfway through the pandemic, because this was already a problem before, but I feel like it just went to exponential levels because everybody was like stressed to the max,
Right.
living in a lot of fear. And, I was like, all right, enough of this. You can choose to live however you want to live, but like let's reel this in. So I created the elevation movement, which really focused, and I realized that I was intertwining these three things through all of my programs. And I was like, I feel like we got to put a name to this for no other purpose than just like having people recognize like this is what I stand for. And so it covers identity, skill set, and mentorship. And I was like, this is something that I think is missing in a lot of other programs, just period. Like forget if they're online or in person, and right. And so we all give skill set. We all teach skill set. That's a big bulk of a lot of courses. Some will say I'm gonna provide mentorship, but then don't actually, or the mentorship is not all effective, or in most cases, it's just not there, quite frankly. So that was really critical because, okay, we've learned these new skills. Well, where do we go next? Like, how do we apply it? And what happens if I hit some roadblocks when I'm new to applying that? Like, we need a place to be vulnerable and to be able to grow as clinicians. And so, like for my programs, there are both free and paid mentorship options. Like after my courses end, where like you join the alumni group and you can ask questions in there, and the mentors do pop in and answer them occasionally, like in the free group for like Feed the Peds, for example. Like with the Myo course right now, we give you 3 free months of the Myo membership because we want you to have access to the weekly office hours, to all the Zooms that we do, to all the past ones, and the Q&A wall, so you can come and ask your questions, because I think it's so critical. If you have this dying question that's like, I'm ADHD, so it's going to stick in my brain and I'm not going to be able to focus until I get an answer, or if I at least I need to write it down somewhere so I can move it on. Like for me, that was really important. And then the biggest piece that I've never seen included in any program in our industry that I see a lot more in like the online business world from coaches and mentors is identity. And what I do see is identity being taken away from therapists, with a lot of therapists saying, you can't call yourself a myotherapist. You're brand new. You can't call yourself, a feeding therapist. You haven't done this long enough. Like you can't, we're not going around and saying we're experts. Right. And I'm over here going like, well, actually, if we're going to like back it up to like neuropsych and like subconscious identity and stuff, which I know is a little woo for some people, but this is rooted in science. If we don't first own that identity and recognize that we are that role, then you can listen to trainings all day long. You can attend trainings all day long. You're never going to identify as being a person who can take that information and put it into practice. And so I teach this be, do, have model, which is something that one of my mentors, Jim Fortin, taught me, whereas most people work from have, do, be, and he works from be, do, have. And the be basically says you need to be that person on a subconscious level before you can do the things and then have what you want. And so we apply that at the beginning of all of my programs. And I teach everybody like in 10 minutes, like how to basically step into this role. And I give them permission to say, I am a pediatric feeding therapist. I am a myofunctional therapist. Because if we don't really own that, then that's where we see a lot of them spending thousands and thousands of dollars and floundering afterwards, kind of going like, well, I don't do feeding. Like, I'm not a feeding therapist. Like, what do you mean? I can't call myself that. This person told me I couldn't do that. I'm like, you're not saying you're an expert. You're not saying you know how to treat everything that comes your way. You're just owning an identity. Like, this is you already have the license that tells you can call yourself this, right? Yes. So it's just, and I can't tell you how many therapists have messaged me thanking me like in tears and basically saying like, wow, I never realized that this was such an issue until I realized that I've always been told my whole life that I can't. And now you're saying, but I can. And now like, I'm super excited about this journey. And I think that also allows them to more readily step into learning as a critical thing, like being that critical thinker.
Being open.
Yeah.
I actually just read one of Jim Fortin's when you recommended a couple of years back, a couple mentors to follow. I do receive his emails and podcasts, and I actually read one this morning and have shared a couple of those on. So thank you for that. And I do think it is helpful. Your mindset is really where it starts.
Yeah.
All right. So just a quick tidbit. You're in Florida. You're wearing a nice blouse and I'm wearing this sweatshirt or sweater and still freezing and shaking over here in North Idaho. I do get to come visit Florida next month. I'm so excited and go to Walt Disney World with my kids, and that'll be the first time for us. But
Yeah.
lucky duck over there in the warmth.
We were just in Disney. It
And
was great.
what took you to Florida? That was a curiosity I had. What took you to Florida?
I think that so I'm from like Montgomery County, Maryland. I grew up there. I went to University of Maryland. Like I never moved too far from home. Like with my now husband, like we lived in Northern Virginia. He was in DC when I met him. So like I've never left that DMV bubble. And I think part of it was like a little scary to even think moving away anywhere. And I refused to do it because my family was there, my parents, and I was like, we're going to have small kids. Like I want them to grow up around their grandparents. My parents are very helpful and very like, integral part of our lives. And so we, I think, all just got like COVID stir crazy, and our schools were shut down for like almost a full year. Well, actually more than a full year, but Lily was in pre-K when schools initially shut down, and she was like melt off her chair, can't sit here for a 20-minute Zoom. And I was like, this is a kid who's like pretty smart, and she's actually tested into the gifted range. And so I think for her, it was like just not very entertaining. I don't know. She wasn't super into it. And so I was really concerned about like her entering kindergarten. So I chose to homeschool her. And I was like, this is fun. So here we are. We've launched a business online. It's very successful and very time consuming. I am also running a private practice that has like all these administrative responsibilities on my plate and trying to navigate, all of the COVID changing things from one month to the next. I was like, and now I'm homeschooling a child where like, hi, I've never done this before. So yeah, at the end of the day, I was like, yeah, no, I want my kids to be in school. I don't trust that the schools are going to be back open in the fall. She would have had 1 month at the end of school that she would have been in person in her kindergarten year. And she would have already graduated the homeschool program at that point. So I was like, well, we're done. And then my other daughter hadn't been in preschool either because her school also shut down completely for that school year and reopened in time for like camp. So she went to camp. But we were sitting around and my husband just like, we just started talking, throwing the idea around, and my grandparents, one set of my grandparents are down here. And my parents were like, well, we would move. And I was like, you would? I was like, okay. I was like, don't say these things because I'm crazy. And if I decide that I want something, like we're gonna make it happen. And so
I thought you were gonna say they would come visit you.
No. They were like, we will move. And I was like, game on. So my husband found this like new build community, and we basically said, okay, people, we're signing a contract. We're building a house in Boca Raton, Florida. And they were like, you're what? I don't think anybody actually believes that we would do it. So the house will be ready like in the end of April 2022. We've been building it since October 2020, and it's pretty exciting. I just got to the point though, like we were maybe not going to move until this spring, and I got to the point where I'm like, I'm over it. I am over like everything being shut down here. Like I need change. I need change. Warm sun over the cold weather. I've lived here all my life. And so like a year ago, I was like, let's do it. Let's find a rental. And so we found a place that started last June. My parents moved first actually. And then we moved at the end of the summer once the girls were done with camp. And, we moved August 1 and school started down here August 10th. And I was like, it was, I think, a really, really great and healthy decision for us because it allowed us to get back to some sense of normalcy. It's interesting because Palm Beach, I joke, it's like a 50-50, like it's 50% like COVID cautious and like up north kind of down. This is like the one county that's like this and of all of Florida where we moved. I'm like, and then the other half is like a free for all, like masks and like there's no pandemic. So it's kind of an interesting mix to be living amongst that, but it's definitely a lot more freeing than where we came from. And my biggest goal again was just, I wanted the kids in person in school. And I think that being able to look out my window at palm trees and sun, even if it rains, it stops 20 minutes later. So, I'm like, it's just, I think been a really healthy, positive change for us.
Yeah, and we have up here in North Idaho, and then I'm right on the border of Idaho and Washington, and we work in both Idaho and Washington, two very different states. And so we've been, in school over here in Idaho. I'm from Washington. My parents are in Washington, and I get reports of, what their schools are doing. And it's so interesting how just crossing a border it's like you're in a different world. It's crazy.
Yeah. Yeah.
So,
Yeah.
well, I hope you like your new home down there in Florida. I am very jealous of the sun. It's been freezing here and freezing rain. I think my husband had snow where he works yesterday. So, looking forward to some sun in Florida next month for me.
Yeah.
All right.
Let me
Well,
know Disney tips. Happy to share.
yes. Thank you so much, Hallie, for joining me. I would love to be able to do this again with you sometime. I think that we've gleaned some awesome information for you. I thank you so much for that and your contribution to our community and our SLP and OT and clinician community. It's super helpful and appreciated.
Yeah. Well, thank you for having me. I'd love to do it again sometime.
All right. We'll see you next time. Bye. For more clinician coaching and resources from Lauren Tandy and Tandy Therapy Box, hop on Facebook and join her clinician community, Tandy Therapy Box, and Early Intervention Telepractice. Tandy Therapy Box is a place to be for clinician coaching direct contact with Lauren Tandy. Early Intervention Telepractice is the place to be for clinicians needing general resources for birth to 3 and beyond. We look forward to seeing you there.